So from here, all you're going to do is, here we're using the table to stabilize the forearm. For all the forearm exercises, for the most part, you want to stabilize the forearm, at least for the few that we're going to show here. This is going to be working your pronators and supinators, which are the ones responsible.
You want this to be 90 degree? Or?
Yeah, about. It doesn't have to be perfect 90. The big thing is to make sure your forearm's flat here, and so we're not getting a lot of elbow flexion and extension. So from here, all you're going to do is you're going to lower the head of the bat down to the level of the table, nice and controlled. And then from there, you're going to take it back over and bring the head of the bat down to the other side here. And you're looking at basically just trying to bring it level to the side, or basically parallel to the table on both sides. And again, this is working your pronators and supinators, which are going to be the ones responsible for basically turning your palm up and turning your palm down.
So if I'm not feeling any pain, which is key, I can slide down and.
Yep. And so generally, I have people start with choking up on the bat just to reduce the resistance, and then if it's easy or you're not having any discomfort, then you can choke down or move down the bat, which is going to give you more resistance because you have a longer lever. And if you're at home, you can always do this with anything that you have. A golf club works fine, a hammer, something like that. I mean, any of those types of things work just as well. And then
if I don't have a table, I can just do it on the leg?
Correct.
Okay.
Yep. And same thing, you'd just be bringing it down to parallel with the floor. And again, nice and controlled, so you want to do, basically get it down there, hold it just for, probably not even a full 1 count, but just long enough to be able to maintain it. In other words, you're not swinging it back and forth. You just want to have a nice, kind of controlled fashion back and forth.
Okay.
And then if it gets, like we talked earlier.
So if you feel pain, stop.
Correct, yeah. And you always want to judge it based on that. I mean, obviously you can pain. The big thing to be able to differentiate between those, any kind of pain or muscle burning, like a lot of times people mistake muscle burning, which is actually just the muscle working, which is a good pain, to a pain that's actually a bad pain. So if it's mimicking the pain that you've had before, then yeah, I would back off, maybe choke up the bat or something like that.
But you could have some soreness just because you're working new
muscles. Yeah, and there's nothing wrong with that. So, and then if you wanted to show that one, if there was something really, if you're obviously as you move down the bat, if it's getting really easy, you can always actually strap a weight to the top of the bat. And again, you could do this with anything that you had at home as well. And just keep in mind that since it's a long lever, this is only a pound, it's going to produce actually a bigger effect than would be.
I'm not even going to attempt it.
Yeah, so it's going to be heavier even with just a pound. So again, I would start choking up and then move down, but that just gives you some options for increased resistance.
Perfect.
So yep, so these are just going to be working.
These are called?
This one that when you're going to be pulling up, this is called radial deviation. So it's just working some of the muscles on the radial side, which is going to be the thumb side of your hand. And then when you flip it over, you're going to be doing just the opposite, and you're going to be kind of pulling up, trying to hit your elbow. And that's going to be called ulnar deviation. And you're just pulling it up on the ulnar side of the hand, which is the pinky side. Okay, and so this is, again, just really working on touching all those muscles.
20 reps?
Usually I have most people do 3 sets of 15.
15.
Yeah. So, but you could do 20 reps.
Okay.
But usually anywhere between 10 and 15 repetitions is pretty good.
And as the therapy progresses, 6 months down the road, you probably want to stay with the reps, maybe increase the weight as you go.
Right. Yeah. Okay. I would progressively increase the weight, just maintaining that ratio as far as the repetitions and the sets, but then just increase the weights accordingly. So these next two are going to be working actually the forearm flexors and extensors. So in this position here, we're working the forearm flexors, which are going to be all the muscles that start on the inside of the elbow or on the medial epicondyle. And just as Dave's doing here, he's curling up, and you're looking at maintaining the forearm flat on the table. You could again do this off your thigh if you wanted to, but you just got to make sure that you're not getting a lot of motion where you're actually doing a bicep curl. So if you curl up like all the way, so you don't want to do that. Okay, you could combine them, but we want to just make sure that we're isolating in here. And then going the opposite direction is going to be working wrist extension. Okay, and so all these muscles are running and attaching over here on the lateral upper condyle. And again, just like Dave's showing, he's got the forearm stabilized, and you're just pulling up. Again, 3 sets of 15 is usually a good place to start. Okay, and typically you'll find that you're going to be able to do more weight into flexion than you are into extension. The flexors are typically stronger.